So tonight's about better understanding the problem that you are seeking to address, which is a subject that's very dear to our hearts in the charity. What I want to try and do is set the scene and then try and describe, well, I will describe three common problems that I've seen, that we've seen in the charity. Before I go on to that, I'll just give you a bit more background on the charity. So we have a long history. We've been around about 500 years or so. We're an independent charity, but as our name would suggest, we have a very close relationship with Guy St Thomas's Foundation Trust. It's good to see some people from the Trust here tonight. We have an endowment of about £600 million, and we spend about £20 million every year to support innovation, to create the ideas that can have a really big impact to improve health. And largely we do that through grants, not exclusively. And I think whilst we've been quite a reactive grant maker, we are, I suppose, trying to be more proactive, and say a bit more about that in a moment. So in terms of where we work, so I'm afraid we're based in South London, not East London. So we are based in two boroughs of Lambeth and Southwark, 600,000 people, very, very diverse, huge amount of churn as well. We have some amazing health institutions locally, such as Guy St Thomas's Foundation Trust, obviously, but there are others there as well. And we work with them, but there's really not great health outcomes in the local area. So there's a lot of need, and that's what we seek to do. In terms of how we work, as I said, we want to support ideas that can really make a big difference in terms of health outcomes. And as we have thought about this, we think, looking at our back catalogue, as it were, that there are 5 key ingredients for this. First is understanding the problem, which obviously I'll go on to say a bit more about. But we also have actually staying focused on the impact you want to have. Once you've understood the problem, be focused on solving it. Build the right team. Know what the evidence is you need to capture. So work out what is your next step at the end of this stage. Who needs to make the decision to take you to that next step, and then make sure you've got the evidence to get there. And then, kind of obvious, but establish and maintain the right relationships. So those are the 5 key ingredients, and I'm going to say a bit more about understanding the problem. Thank you. So firstly, the thing I quite often see is people assuming that they know the problem when they don't know the problem. At its most basic, this can be people actually not even looking at the evidence base. And we had one not great example before my time, before I joined the charity, where we had a grant that was made, and they all assumed that it was for lung disease, that they assumed that locally prescription rates for various drugs were very, very high. And then they looked at the data, and actually we were below the national average in terms of prescription rates, and so that was fundamentally flawed from the beginning. That wasn't great for the charity to look at that either. But mostly what we see in terms of assuming you know the problem is people, I suppose, taking what they think is the problem and not understanding the problem from an end user perspective. This is how it mostly manifests. And we've got a really, I think, good example of this locally. We have a big integrated care project in Southwark and Lambeth. And I think this started off from a space where it was very much from the systems problem. Because what it was all about was saying, how can we reduce emergency admissions for older people so that they come into hospital less? That's a really good thing for the NHS to try and do, because hospitals get clogged up. If you talk to older people, what they really want is not to not be in hospital, although they do want that. What they really want is to have a good life. They want to live at home for as long as possible. They want to not be lonely. They want to be living, not existing. If you can support them in that, then, as it turns out, they largely don't turn up to hospital as much. But if you focus on that, on what they want, you'll end up doing quite different things than if you just focus on reducing emergency admissions. So don't assume you know the problem. Second issue we see is assuming you know the solution. I couldn't believe that they kept making mini discs until 2013, which was Sony's state-of-the-art method of portable music until 2013, clearly. It's quite easy to get fixated on a particular solution, even if you think you understand the problem, and you get fixated on it and you keep going down that road. So one example that we've seen in the charity is we have a good public health grant program that we supported. One of the aspects of that is solving the problem of how can you increase the knowledge and skills of health staff in terms of understanding public health. So this won't apply to anyone in this room, I know. But if you get really, really drunk and you have to go to A&E to have your stomach pumped, that won't apply to anyone here, I realise. But if you do that, then that's the moment when the nurse or the doctor in A&E should talk to you about your drinking. And maybe you should drink a bit less on a Wednesday night in Shoreditch. And helping to give staff those skills is really important. But what we have seen at the moment is that some of the academics that are working on this programme, they're sort of fixated on the idea of having a sort of mini Masters of Public Health. A Master in Public Health is usually a year-long endeavour, and a mini one is it's only a few months. And that's not a bad idea, but the idea that that will work for the 20,000 staff in Lambeth and Southwark that we were thinking of supporting is probably not going to work. So they're fixated on this idea, and how should I say it? There's an ongoing dialogue between the academics and the public health people about how to resolve this. I'm sure we will get there. The last one is poor scoping. Usually this is scoping too narrowly, but not always the case. And what I usually see is this happens in two ways. Firstly, people focus on tech, not people. And the second way is they focus on an institution, not people, not individuals. And we've got another example of this where we have a program that's happening in Guy's and Thomas's, which is called Tahiti. One thing you'll learn about health is that they have to turn everything into a horrendous acronym. Tahiti stands for Transforming Outcomes and Health Economics Through Imaging. Exactly. It is actually a great program. The idea behind it is you use imaging more quickly in the process, because at the moment you quite often have to wait a while to get the imaging that tells you whether you have something wrong with you or not. Most of the time you don't. And so some really creative clinicians said, look, we can do much better than this. We can use a technology sooner. And they were very excited about this, but they were very focused on their bit of the world, and they were very focused on the hospital. And we said to them, this is really good, but you do realise that the tech bit's massively easy here, and what you're talking about is a huge behaviour change intervention. And all those consultants who you're effectively taking away what they consider as their patients, because they'll be seeing them later, or just not at all. So you really, really need to think about that. So they needed to expand their scope so that they thought about not just the technology, and they also needed to think about not just the hospital, but general practice as well, because that's a fundamental part of the journey for a patient, effectively. So those are the three problems, the problems with the problem, if you like. I hope that's provided a useful framing. I'm not going to go into how we solve them in the charity. We obviously do try and do that. Please look at our website for more of the work that we do. The following speakers will say a bit more about how you can overcome these problems. Hopefully we do some of them in the charity, but I'm sure that I will be learning something tonight as well.
Thank you, Ollie.